Hydrea is used to reduce the number of painful crises caused by sickle cell anemia and to reduce the need for blood transfusions. It is also used to treat certain types of cancer such as chronic myelogenous leukemia and squamous cell carcinomas. The daily dosage and optimal timing for taking Hydrea will depend on your specific condition, so it's important to follow your doctor's instructions carefully. Before starting to take Hydrea, make sure to read the medication guide from your pharmacist. Take this medication by mouth as directed by your doctor, usually once daily, with or without food. The dosage is based on your weight, medical condition, lab results, and response to treatment. Your treatment may be stopped for a short time if your blood counts are too low. It's important to keep all medical and lab appointments. Do not increase your dose or use this drug more often or for longer than prescribed. If you are using the capsules, swallow them whole. If you are using the tablets, swallow your dose with a glass of water. Only split a tablet if it has a score line and your doctor has instructed you to do so. It's important to wash hands before and after handling the medication or its container, and to wear disposable gloves when handling the medication. If powder from the tablet or capsule spills, wipe it up right away with a wet paper towel and throw away in a closed container. Clean the spill area right away with soap and water. Since this drug can be absorbed through the skin and lungs, women who are pregnant or may become pregnant should not handle this medication or breathe the dust from the tablets/capsules. Remember to tell your doctor if your condition does not get better or if it gets worse. If you experience nausea, vomiting, loss of appetite, mouth sores, diarrhea, or constipation, it's important to tell your doctor or pharmacist right away. Serious side effects can occur while using this medication, but your doctor has prescribed it because they believe the benefit outweighs the risk. It's important to be monitored closely by your doctor to decrease the risk of serious side effects. If you experience skin problems, mental/mood changes, seizures, shortness of breath, yellowing eyes/skin, dark/bloody urine, or signs of kidney problems, it's important to tell your doctor immediately. Seek medical help right away if you experience chest pain or notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects, so always contact your doctor or pharmacist if you notice any other effects. Hydrea can decrease bone marrow function, leading to a low number of blood cells such as red cells, white cells, and platelets. This may cause anemia, decrease your body's ability to fight an infection, or cause easy bruising/bleeding. If you develop symptoms of infection, easy bruising/bleeding, pale skin, or unusual tiredness, contact your doctor immediately. It's important to protect your skin from the sun while taking hydroxyurea, as it may increase the risk of other cancers such as secondary leukemia and skin cancer. Avoid prolonged sun exposure, tanning booths, and sun lamps, and use sunscreen and wear protective clothing when outdoors. If you notice any symptoms of cancer, such as swollen glands, sudden weight loss, night sweats, or unusual skin growths/moles, be sure to inform your doctor right away. Before taking Hydrea, it's important to let your doctor know if you have any allergies or if you have a history of kidney or liver disease, blood or bone marrow disorders, HIV infection, high uric acid levels, or if you have had radiation treatment. Hydrea can increase your risk of getting infections, so it's important to avoid contact with anyone who has an infection that may easily spread, such as chickenpox, COVID-19, measles, or the flu. It's also important to talk to your healthcare professional before getting any immunizations or vaccinations while using Hydrea, and to use caution with sharp objects and avoid contact sports to lower the chance of getting cut, bruised, or injured. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are an older adult, you may be more sensitive to the side effects of this drug. It's important to discuss the risks and benefits of using Hydrea with your doctor if you plan to father a child, and to use reliable forms of birth control during and after treatment to avoid pregnancy. If you are pregnant or plan to become pregnant, you should not use Hydrea as it may harm an unborn baby. Women using this medication should ask about reliable forms of birth control during treatment and for 6 months after the last dose, and men should ask about reliable forms of birth control during treatment and for 1 year after the last dose. If you or your partner becomes pregnant, it's important to talk to your doctor right away about the risks and benefits of this medication. Hydrea also passes into breast milk and may have undesirable effects on a nursing infant, so it's recommended to consult your doctor before breastfeeding while using this drug. When taking Hydrea, it's important to be aware of potential drug interactions that may affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription, non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. You should not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Hydrea include didanosine and stavudine. It's also important to note that Hydrea may interfere with certain lab tests, which could potentially cause false test results. It's crucial to inform lab personnel and all your doctors that you are using this medication. As for the best time to take this medication and the daily dosage, it's essential to follow the instructions provided by your doctor. They will be able to determine the optimal timing and dosage based on your specific medical condition and needs. If someone has taken too much Hydrea and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical assistance. In the United States, you can call the local Poison Control Center at 1-800-222-1222. Canadian residents can contact their provincial poison control center. Symptoms of an overdose may include swelling or scaling of the hands and feet. It's important not to share Hydrea with others. Before starting and while taking this medication, you will need to have lab and medical tests, such as a complete blood count and kidney/liver function tests. Make sure to keep all medical and lab appointments. Your doctor may also recommend taking folic acid while taking Hydrea to reduce the risk of anemia. Be sure to ask your doctor for more details about this. If you forget to take a dose of Hydrea, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take double the dose to make up for the missed one. When it comes to storing Hydrea, it's important to keep it at room temperature and away from light and moisture. Make sure not to store it in the bathroom, and always keep it out of reach of children and pets. When it comes to disposing of Hydrea, do not flush it down the toilet or pour it into a drain unless instructed to do so. It's important to properly discard the product when it's expired or no longer needed. If you're unsure about how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.